Okay, all right, great. Well, good morning, everybody. It is June 15th. We're here for a work session, and we have our Human Services Department with a guest to talk to us about Language Access Interpreter Network. And let's just do some intros real quick. And then Maria has a presentation that she shared with us that we can pull up whenever you are ready, but let's do intros. Maria, I met you when you came in. Sarah, Sarah Mutch, Lake County Commissioner, and Kayla.
Yep, Kayla Marcel, Lake County Commissioner.
Chris Floyd, Lake County Attorney.
Jay Bergman, County Manager.
Janine McGee, Lake County Department of Human Services Director.
Kristen Logan, Project Manager at DHS.
Good morning, everybody. I'm Maria Carrion Ayers. I'm a consultant working with Lake County Human Services on language access.
Excellent. And come on folks in the back
Oh,
there.
I thought we were safe in the back row.
You are not safe.
Hi, I'm Liz Miller. I do county operations.
My name's John. I'm Chris's summer law clerk.
Somebody like a clerk. Alrighty. Do you want to do any intro or?
Yeah, I can do a quick intro. And are you comfortable here? Do you want to sit there?
Well, I might just kind of sit there to be able to see everybody if that's or there.
So you can see the screen.
Yeah,
Perfect, yeah, I can do
Definitely.
that. That's perfect.
You can
Otherwise,
put them there.
Otherwise, I may cram my neck. And that is a
Yes.
thing. That is a thing for
Yes,
me
it
now.
is.
Yeah.
No worries.
So, yes, I want to express my appreciation for the board and leadership support of this project that we have conducted over the last year. It is funded by a grant from the Department of Healthcare Policy and Financing under their core pillar of improving customer service and
I forgot.
is like
The excellence outcomes.
yes. So we received $48,000 for this project, and it covered the cost of consulting and our project manager's time on it, and then my time working on the project was the contribution towards the grant. And we have some fabulous outcomes to share with you, as well as ideas for going forward and a couple of requests. So we hope that this is the beginning of the conversation on this project and possibilities and opportunities and anything that you envision or would like to see come out of this going forward. And I invite us to just kind of think big and think out of the box and be able to envision all the possibilities that this work could mean for our community, not just our department, but the community as a whole and really the state of Colorado. So maybe even bigger than that. So I will let Maria take it over. She has been our fabulous consultant on this project and has lots of experience. We have left plenty of time to go into this and then ask questions, and I'll let you decide if you want questions as we go or afterwards or whatever that looks like.
Certainly we have. If you have questions in the moment, please feel free to reach out, but I did leave a whole slide at the end. And yeah, I'm really just interested in the discussion or questions you all may have about it.
Excellent. One quick thing before we start, can you just let us know where we are in that process and the project right now so that we can, in the context of
As
what
you
you're gonna
think about
present to us, yeah.
So we wrap up June 30 with the state fiscal year grant funding. And we are already in the midst of writing the grant for the next year, which is due next Friday. So as we've been going, we've been constructing what the next grant application will look like as well. But a big piece of that is going to be adding to that funding structure over the next year. So there's some core and foundational things that we'll be putting into that grant application that we hope will also help build to the resources and the structure of the project. So we expect and hope to continue very much what we've been doing we'll put out an RFP for the, we expect that we'll probably get funded, and I don't think HICPUF would mind us saying that. We actually did our presentation to HICPUF yesterday. It went very well. They're really pleased with this project, with both of our grant projects, and we will put in a request for that we will have cover a lot of these basics, and then want to grow it from there. So yeah, and we've expended our grant funds on this project. I would like to hope to envision that this is a grant project for now, but that maybe it could even be incorporated on a larger scale, like one of the departments permanently funds it, because it's a resource for all counties across the state, that kind of thing.
Excellent.
Other good question, other questions?
No, nothing from me right now.
I will pull up your long presentation.
Still a long one.
Oh, wait, let me just share screen first. Sure.
I'll also share really quick that other counties, I think, are really interested and have been paying attention to this work, and so we're excited to see where it goes.
You can drive, please.
Well, yes, as Janine set it up, thank you all. I'm really excited to be able to share this work. I really do want to take a moment to recognize the leadership within Lake County Human Services, and that is, certainly Janine, Kristen, but I also want to shout out to the staff that have been really leaders in raising these issues and being advocates for improving this, and again, really being champions for making sure that we're able to get things like this going. So today we're going to be talking about, in a larger context, why CLASS, which stands for Culturally and Linguistically Appropriate Services, why it matters in the context of Lake DHS, but really in all our interactions as businesses and organizations that serve communities, why that's important. And then we're going to talk about a little bit, relating to the legal requirements and also best practices around language access and culturally and linguistically appropriate services. Dive into, that frog's gonna come up and start bugging me now. The case for CLASS from an organization perspective. So whether you're a healthcare organization,
Just in case.
thank you.
This room does that to me all the time.
In case you're, regardless of what kind of organization you are, if you're a healthcare organization, a school, any type of organization, why this is an important piece of your infrastructure and considerations. We're going to talk a little bit about definitions, because a lot of the terminology used related to language access does get used interchangeably. And then we're going to dive into what we've done at Lake County Human Services specifically, guide you through each of those. Again, we have time for questions, and then we'll get started. So why does language, culture, and communication matter? And this is a quote from the National CLASS Standards, which is a nationally recognized best practice related to providing culturally and linguistically appropriate services. It began with a focus specifically on healthcare. I want to say it was 2011, it was revised. And because these are such good practices, they really are transferable to whatever type of organization you are. And so those standards were revised and updated to encompass other organizations and make that adaptability doable, but also further clarify and refine what those standards are. We won't dive into those, but in a nutshell, this is why it's important. And so we're going to talk a little bit about the legal requirements and what that looks like. So from a federal perspective, it all comes down to Title VI of the 1964 Civil Rights Act, which basically was the act that tells us, you can't discriminate based on somebody's race, based on their ethnicity, their gender, and the other piece of that was their national origin. So national origin is a piece of this law that encompasses language access, which tells us that if somebody is needing or wanting services from federally funded or federally conducted organizations, they have a right to have those services, and that language barriers or your physical ability or your sex should not prohibit folks from accessing those federally funded services. I'm forgetting the year. I want to say 2008. Executive Order 13166 came about as a way to further refine that and clarify that for organizations. And then the most recent piece of refinement related to, again, that Title VI origin is the Affordable Care Act, where it really spells out patient protections related to language access. And so those federal requirements are often confused with some best practices, which aren't required, but again, still have that same legal basis for, or at least they refer back to things like Title VI. So from the healthcare perspective, we have the Joint Commission, the National Committee for Quality Assurance, the Public Health Accreditation Board, I think recently adopted those. I was still at the state, so I want to say that was in 2014, something like that. And then again, another guiding principle that we use are the system of care core practices, which is something that really informs a lot of the work within the humans realm and the system of care. It's a core guiding principle there. So just to further define and explain a little bit of these, as I mentioned before, that piece from Title VI, again, no person on the grounds of race, color, or national origin shall be denied receiving any program assistance or services from federally conducted or federally assisted programs. And the thing that I like about the next section is that oftentimes Title VI and the requirements gets conflated with unfunded mandates, and this is a way of kind of explaining how this Title VI is really different from that. Like some certain requirements do apply to like certain populations or certain programs, but that really Title VI applies to all federally conducted services and programs. And if you are receiving funds within your organization, even if those funds are within a particular program, as a recipient of federal funds, the entire organization has an obligation to comply with Title VI requirements. And the piece that I like about Executive Order 13166 is that it really helps clarify for organizations that this is making sure that people, so LEP stands for Limited English Proficient. I like to use the term linguistically diverse, and that's what we adopted in the policy. But folks from linguistically diverse backgrounds really do have access at all points of contact. So whether they're calling through the phone or looking at the website, or if they're talking to an administrative person at the front desk or somebody that's handling their case, that they're able to access those services again at all those points of contact. And we do see over and over that we do have certain racial and ethnic groups that are overrepresented because of different challenges, language access being one of those barriers. We see that kiddos are removed unnecessarily from their biological parents, and that their biological parents are denied access to culturally competent reunification services. So this is the system just not knowing what to do and not doing it in a way that supports those families, even denying that kinship placement, keeping them in foster care for an unnecessary long period of time. And really what it boils down to is that these family members are denied full and informed participation in what's happening within the courts, within social services. And I think this is something that we see play out all the time with the families that we work with. And so why does this matter? Why should this matter for organizations? And I always do like to ground this in that equity is really not everybody getting the same thing, but it's what people get what they need. It's a conversation I have with my kids about like, you all don't have to get the same thing. We all get what we need. Just because somebody got this doesn't mean you get that. But that's, what it boils down to is we all get different things because we all may need different things.
Can I ask a quick question?
Yes.
How much of, what was this expanded out to any other departments, like probation?
No, not yet.
Right
This is
now
all within
for-
Human Services,
Okay,
but it was within all of our units. So
Okay.
it was funded by a public assistance Medicaid-based grant, but that only paid for 40% of the project because it was all of our department.
Okay.
So it applied to all of the units in our department. So we haven't taken it.
got it.
This will also apply to transit. So this is a requirement for transportation dollars.
Should I X out that?
Yes.
Okay.
Yes, please.
Okay.
Sorry.
And you can minimize that too,
Yeah.
and that, like, yep, that,
Yeah.
one. Yeah.
Oh, perfect.
Perfect.
Okay, thank you.
Yep.
So what does this mean in terms of what organizations can do? And one of my favorite things about working in the DEI space for 20 years is that when we focus on things like language access. DEI topics could seem so overwhelming. I'm just like, oh my gosh, it's just so complex. Where do we begin? With language access, I like that it's very tangible. It's something very practical that organizations can do. And for me, it's a really critical part of your infrastructure. And I'll have Janine and Kristen chime in about what this meant for them as an organization, really embedding it into their infrastructure and how they're able to make more informed decisions. But it boils down to improving that quality of service, improving the efficiency and the effectiveness at which we're able as organizations to do the work, but also support our employees, decreasing risk. Again, meeting those regulatory requirements is kind of the stick for why we're supposed to do this. It's the book on, the laws on the books. But really, for me, it just boils down to doing the right things and helping people. If there's a barrier, let's meet people where they are and let's get them that help. And then so just diving down into the organization infrastructure, what this does for organizations, when you set up systems and organizations have that data to look at their utilization, to look at their cost and make informed decisions about how they allocate their resources. They're able to more efficiently and more nimbly respond to those client needs. We set this up recognizing that there is a larger percentage of Spanish speakers within Lake County, but they're just as prepared to respond to those folks now if they had an influx, if you all had an influx of, Farsi speakers or Urdu speakers. It helps everybody. It improves the way folks are able to communicate. And it again goes back to that meaningful planning, because now you're seeing all of your expenses, you're seeing all of your needs. And again, that helps with the resource allocation. It helps improve those outcomes for family. I think it helps improve satisfaction throughout the community. But I will say, and Janine, please chime in, I feel that staff, particularly bilingual staff, just feel so much more supported and heard. And for the non-bilingual staff, I feel that they feel empowered, correct me if I'm wrong, that they now have the tools they need to do their job without having to reach out to those, bilingual coworkers. And again, that all goes to improving efficiency and effectiveness. So it is a constant quality improvement process, and I appreciate Janine saying that, hey, as we were doing this work, we started writing in what we need for the next grant, because I really think that's the approach that we've taken with this project. It's just continual improvement and refinement. So making sure we have equitable access, again, those improved outcomes, and we're avoiding costly errors, and we're avoiding misuse of our employees' time. So it's much more expensive, if you will, taking somebody who is a bilingual staff that might be a higher salaried employee and asking them to spend 2 hours of their time interpreting rather than having an interpreter present for that. So using your resources where you have them. You're able to be more accurate when you're taking information in from the family. And it says diagnosis, but in this case, it would be making sure that you have that information to make the correct recommendations for what services they may need, which could include treatment. But diagnosis, not just in the medical term, but diagnosis sort of in the general term of like, what is it this family needs? What services do we need to provide? Yes, so just to further promote what it does for effectiveness and efficiency, it's going to save you money. The conversations that I've had over the years with organizational leaders is like, man, translation and interpretation costs a lot of money. We can't afford to do that. And my response is, you can't afford not to do it, because the amount of money that you waste by not having these services in place does add up and does impact your organization over time. And this is in a very monetary way, but this also impacts your organization in terms of staff, particularly bilingual staff who just cannot sustain, the workloads and expectations, and they end up leaving. So that's why we see a lot of turnover, particularly within bilingual staff, because this is a significant burden on them. So again, you're going to have better use of those limited resources. You're going to engender trust within your community. Now folks feel and know that they can go, we hope that this is something that the community is starting to feel, that they can go to Lake County Human Services without having to wait for their child to get out of school and have them come interpret for them, or feel like, I don't know that I trust that my information is being understood, that they're able to understand me. And again, this is going to avoid costly problems, and it allows the organization to really tailor those services.
Sure.
So, and it will overall decrease risk. Again, class comes from the medical perspective, and so while malpractice might not be, something that you all have to worry about, there is sort of malpractice effects, right, that can happen. Diagnostic errors and the fact that we're treating these families and we don't understand their language or their cultural context, so it leads to those adverse effects of let's remove this child from this family. The parents aren't informed. So that leads to, to treatment in those services, those miscommunications, and those misunderstandings. So let's talk a little bit about definitions. So interpretation, translation, what's the difference and why does that matter? So those terms get used interchangeably all the time. And the reason it matters is because they're, from the linguistic field, they're very different things. So very simply stated, interpretation is spoken or signed. So that's verbal communication. And translation refers to anything that's written. So a pamphlet, a website, an intake form, all of those things refer to translation. And then there's this other element, which is often confused with interpretation, but that's in language translation. And so the best example for that is that you hire a bilingual staff member to be your front desk receptionist, and they're helping the community, they're talking directly with the community, but they're doing their job in that other language, in Spanish, in Polish, in whatever that is. There's two people involved in that exchange, and they're doing that communication in whatever that target language is. And interpretation for these reasons are not the same things as well as in language communication. And there's also the assumption that being bilingual, if you have that bilingual skill, that automatically means that you're able to interpret or translate. And while bilingualism is a prerequisite to be an interpreter or translator, you do need to have specialized skills and training, because interpretation isn't the same as translation. I have been interpreting for over 20 years now, and I am not a translator. I taught myself how to read and write Spanish, but you don't want to hire me for your translation. The example that I shared with Janine and Kristen over the years is that I can bake. I can make a cake at home. It looks like a cake, it gets the point across, it's edible, nobody's gonna die, but you do not want to hire me for your wedding. So that's kind of the skill sets that is different there. Because again, speaking isn't the same as writing.
Right.
I could stand up here and talk all day. I do like to talk, but whenever I do have to write a report, I work with an editor because that is not my strength. And another important distinction there, and why we have to make sure we understand what we're asking for, is that, again, not only are these things different skills, they're different services, and they are priced differently. For interpretation services, you are paying depending on how that service is provided. It could be in person. If you're providing for in-person services, you're going to pay for hours at a time. There's usually minimums. If you're having interpretation over the phone, that's a per minute charge. Likewise with video remote interpretation. If you're buying translation services, that's going to be priced per word, per language. So what, 500 words in Spanish may cost you this much, but if it's in Farsi or Arabic, it may be more expensive because those are languages of lesser diffusion. And it's not only like the words that are translated, but the formatting that goes behind that to make the documents look the same as your English document. So there's also going to be an element of desktop publishing or formatting that's added on to that. So that's why it's important to kind of understand and know those differences. So now that we have a grounding in that, let's talk a little bit about what we've done with Lake County Human Services. And so we've, over the years, starting in 2021, have worked through 4 different scopes of work with these wonderful folks. And the first one started off as, we just need to understand how to work better with our bilingual employees, and we just need to understand what the difference between interpretation and translation, interpretation and bilingualism is. So that's where we started with our first scope of work. And it really was more of an awareness raising effort. The first training, again, was really to understand the needs, because I could go in and give you a class training, and I could go in and give you an interpretation training, but that is less meaningful because this is only helpful if you understand it within the context of your work. And so really that's the way I like to approach these things. And so, well, that was the goal, again, to give these 2 trainings after, coming on and working with Janine and Kristen, really explaining that and having a desire to get a baseline assessment so that we could do this in a more informed way. They were game, so we're like, okay, let's do it. And so really that baseline assessment really helped us understand what those needs were and help us create those specialized trainings. So again, that first training was understanding what those best practices are and how do we work more effectively with our colleagues who are acting as interpreters, and how do we work more effectively with interpreters. And then the second training was for those bilingual staff that are being asked to act as interpreters all the time. Let's get them some training, some grounding in terms of what skills, what are the roles and ethics, what's required to be an interpreter. So that was the focus of those two trainings. And again, to provide some clarification around the legal basis and background for all this work.
Well, I should say, this work with Maria actually started with a Resilient Lake County grant that we got prior to the HICPOP grant. So we defined in our Resilient Lake County work that that was a priority, but then the next step was, well, what do we do, with that? And so that was where that started. And we were really lucky that we were sort of really in the midst of all of that when we applied for the HICPOP grant, and then Maria responded to the RFP, so we could just keep going.
I'm gonna grab my water real
Right
quick,
there.
'cause
Yeah, I wondered if
Yeah, no worries. Talking.
So the benefit was
Talking a lot.
on the HICPOP grant, we could just really hit the ground running on that because we weren't waiting for a vendor.
Well, and I think it was also really nice that so much groundwork had been laid with these efforts that we had done. So part of that baseline assessment, and I will say that baseline assessment that we did was sort of the light version of the more in-depth assessments that I do like to do. And these assessments are based on guidance from the Department of Justice that came out in 2011 that really look at sort of like key metrics. So when we did this the first time, we just looked at a couple of things from that assessment, and also added some questions that really helped me understand what staff perceptions were around bilingual staff, language access, just to kind of get us grounded. But some of the areas of improvement that came out from that assessment were the need to track, like what's going on? We don't even know what's going on, so let's get some tracking around that. Understanding that there does need to be a certain level of qualification, training, and language ability to provide those services, so getting some assessments there. And I think staff really started to get an understanding of the fact that, hey, asking, the client's 13-year-old kid to interpret for them for this meeting probably isn't a good idea. It's putting folks at risk, so really understanding that. One of the big things is like, well, how are we gonna do all this without a policy? So that was one of the big places to start there, understanding the differences between bilingual staff and qualified interpreters. And again, this reliance that bilingual staff felt like, they're always coming to me. And I will say, staff are happy and willing to do this, but it is an additional workload, it is an additional burden. So that is something that is felt. And then there was also confusion of like, for staff who are part of that program, part of the people that are delivering the services, 1 minute they're acting as the interpreter, but then they also have to act as a staff member in whatever role or capacity that is. And what does that do for impartiality, having to go back and forth between those roles? And it is a taxing thing to have to kind of jump back and forth doing those functions.
I want to also just emphasize that piece about tracking language access. I don't know how many organizations track the number of times a bilingual staff member uses their language skills in their job or is asked to interpret, right? So how many times do we actually document that? How many times was so-and-so asked to interpret today, and for whom, and for how long, and for what type of interpretation? Much less, how much of their job. So our focus on this within HR and the bilingual pay differential is about how much are you using this other language in your job that you do every single day. But just to think about how often is that happening, and just to also really think about that's a resource that we're not really, and an ask and a request from a particular group of people that we're not even accounting for, right? And we're not even qualifying or quantifying how valuable that is too. So.
Right, absolutely.
If I can chime in on that, I think it's important that you're recognizing that, and perhaps you do that going forward, because technically there's no legal requirement for county services outside of whatever the state may require y'all to do, or for court documents or anything to be translated into any other language besides English. So making that extra effort, I think, should be tracked and promoted in the community.
Yeah.
Pay attention to that.
And that's one thing we actually came up, again, you know, and our folks who work within the court systems are like, this is an issue, like, we're not required, but what does that mean for the person? And so how do we really make that?
It makes me sad to say that there is at the court injustice in our justice system with the way we're not communicating with our linguistically diverse individuals. So yes, those were some of the challenges staff highlighted. Really poorly translated state documents and legal documents that were only available in English. So if you're a family and you're needing to respond to whatever, you know, legal decision, legal action, how do you do that? I mean, just thinking about that stresses me out, and I speak English. How able am I to understand that if there's a language barrier?
Yeah, and I'll just say, the municipal court has translated all those documents.
Yeah, and then we had, I mean, we think that's a simple conversation, but we had really in-depth conversations about what's a vital document
Yes.
and what's not. And so we're also working on that as a structure, like, and some things the state may provide, but some of that translation is also not always optimal either.
Right.
Gloria found in the assessment for wraparound for the homeless youth, they use a word asking if the youth is a runaway youth that actually translates to fugitive.
Yeah, not good.
And
Yeah.
so, you know, things like that are really,
Totally different meaning.
Yeah.
Yeah, not the same thing. So yeah, all those things, and we do have more conversations in how, as an organization, where Lake County is with that, the approach and what we hope is the ripple effect of other organizations also, you know, putting thought and putting some effort behind this. But again, going back to untrained volunteers, you know, maintaining language supports, having equitable compensation and workloads for bilingual staff, and maybe even further upstream within the hiring process. Like when we ask folks to be bilingual, like what does that mean and how, and what sort of clarifications and expectations are put in their job descriptions.
and just as an example of that, we had an employee who said, well, I'm bilingual, but I'm not comfortable interpreting.
Yeah.
And the expectation was sort of that so I've talked with Ally too about how we need to say, if we say bilingual preferred and interpreting skill sets, or, you know, or do we not require that, and that's something we use the network for. And the other thing to think about is if somebody is interpreting within any function in a county agency, do we ask that they go through the training and certification? And we'll talk about that as we go and why that could be helpful.
Absolutely.
Well, and I wanted to, and maybe we'll get there, but even, like you're saying, that added burden on those individuals, it's an added stress, but also it seems that there should be adjustment of expectations of the job they are expected to do if they are being pulled away from that to do this so much. So how does that, and I'm like thinking 5 steps, how does that translate to, you know, reaching out to the state to say, actually, we're doing this job better and, or attempting to, and we need, like, our formula needs to be increased because we need more folks to actually get the work done, because we're taking the time to make sure it's done right.
Absolutely, and you can only do that by tracking it. And within the first week, and we're getting ahead of ourselves, but Kristen, within the first week of implementing some of this stuff, requests were coming in. And so they have data now. They have data that they can pull to this and they can extrapolate. I'm forgetting the percentage, but somebody did some work around this. And I think it was something, and I could be wrong here, but like 20% more, you know, as a ballpark, but.
A good example of that, so Gloria, in the last year and a half, was able to reach her coaching certification for wraparound and became a certified facilitator. And it took her 3 times as long as the English-speaking facilitators, because the coach who was overseeing and observing all of her work kept saying things like, your meetings are taking too long, or you're not covering this, or you're not covering that. And she would say, do you realize that a bilingual meeting with
is,
a family
yeah,
is going to take at least twice as long, if not
Oh, yeah.
longer. And we may not say the word
Whatever
whatever.
keyword you needed for accreditation.
Yes, because they will literally watch videos of it and you have to have covered everything just right in
And
a
this is
certain
an
way.
English-speaking person that doesn't understand what's happening on the screen
Oh,
or
wow.
being recorded, yeah.
So it literally, and she really fought that, and then the state said, I don't want somebody to have to go through what I just went through in this last process. But then they'll also say, how long should it take, a facilitated meeting take? How many meetings should a family have in the course of their experience and wraparound?
Right.
Without ever really thinking. And they're the ones who promote the class standards and,
Absolutely.
you know, all of this without thinking what that looks like.
Yeah.
For all of the language access piece of that.
did, is there any change? Was that received well, and was there a
It was
change
received
in?
well at the state.
I think there's still some challenges within the system because oftentimes what happens within the system is that they're confronted with a problem and they don't know what to do, so they do nothing. And that's something that's common, that's something that we see. So I think there, with the leadership at the time, there was some recognition. I certainly worked with Chris Meyer on addressing that, but then we're faced with the conundrum of those folks that are providing those accreditation supports or services. There is not the bilingual capacity and workforce there. Gloria is probably among our first. But there was also some real pushback from those coaches themselves about how this really had to be done a certain way. And again, it does come off a little tone deaf within the context of one of the pillars of system of care values. So I will say that work has been done and needs to continue in that direction because I think there's still several things that need to be addressed there.
Is that a feature like legislative?
No, it's a
change
value.
Or a policy?
It's a
in-
value. It's about saying this is important and we're gonna put time and energy and resources and training and shift the structure. So high fidelity wraparound is high fidelity, which is good and bad. And that's the challenge of evidence-based practices, right? So anytime you talk about with evidence-based, you have to ask what evidence and where did you collect that evidence and who represents the folks who were served in collecting that evidence.
And that also is really dependent on a new term that I learned recently called data privilege. So from a language perspective, I know that all folks are not represented in the data we reference in our day-to-day to say, this is why we're doing evidence-based practice, this is data informed, because when surveys go out, those primarily go out in English. And so we are not within our data collection practices really being inclusive to everybody. You know, a lot of it is technologically based, right? So that all kind of compounds the same thing.
Mhm.
I think we're moving in the right direction. We're doing things, so that's good.
It's a lot.
Yeah, it is a lot.
You have to deconstruct everything
Yeah.
when you think about
Yeah.
this. You really just have to pull it all apart.
And one of the key things here, and just wrapping up this slide, one of the key needs was establishing contracted services for helping staff, have that support and access. So again, what we did the light version of the assessment, and that was in June, at the beginning of June, we did a follow-up survey. And again, we looked at 10 different metrics of language access in addition to perceptions of bilingual staff. And from the beginning, when we first did the assessment to when we did sort of the follow-up, we asked staff, did this help you understand this? And we had a response rate between 75% to 90% saying, yes, I had an increase in understanding. And the recommendations that came from that assessment were that Lake County Human Services should do some policy development, some training, and establish some contracts. And so the policy recommendation included things like your policy should talk about like tracking cost, certification, avoiding use of untrained staff, really looking at how bilingual staff are utilized and making sure that those practices are equitable, and addressing things like dual role functions. And then also trying to meet the need for translation within the policy. So these are just all the recommendations. As far as training, again, really helping folks understand what certification or assessments are needed to be qualified linguists. Once again, avoiding those untrained folks, and then trying to strike a balance on how folks are engaging with bilingual staff as part of that training as well too. And then in terms of establishing a recommendation, just really driving home that this is an important part of timely access, and Title VI tells us you need to take meaningful steps And a lot of organizations get bogged down and like, well, we're figuring this out, and that's wonderful, figure that out, but that doesn't mean your populations need to wait 2 years to be able to access those services. So contracted language services are a way to do that immediately. And so when I was at CDPHE, and I forgot to share a little bit about my background with you all.
Yeah.
I'm a professional interpreter of 20 years. I interpreted for University Hospital, from then went on to work at one of the larger language service providers, Seracom International, training folks across the nation related to language access, primarily within the medical field. And then I went to CDPHE to help with their diabetes education program, and I got there and I was hired as a bilingual bicultural diabetes educator, and I was like, great, fantastic, let's do this. And my first day on the job I said, okay, where's language access? And they said to me, what's language access? And I almost cried. I'm like, no. So I made it my unofficial mission to get something done, and I did. So I established the first language access program within a state organization. I'm proud to say that's still up and running. From there, I went to Denver Health, spent a little bit of time with their folks, and was the supervisor for their on-site interpretation team. And after that, I struck out on my own, and I've been consulting for the last 6 years. So while I was at CDPHE, in addition to doing the first language access program, I also worked with the Department of Personnel and Administration to bring about an amendment to what is called the NASPO agreement. So the NASPO agreement is the National Association of State and Procurement Officials. And what this does is allow organizations to access services which might have been cost prohibitive for individual organizations to access themselves. And what that allowed us to do was to go out to language service providers and as a state say, we want your services, and we want some for those services to be accessible to our government agencies and our nonprofits. And so that removed a lot of the barriers, and I'll get into what those are right now, but that was the recommendation given to DHS. And then the other piece was to provide a mechanism for how folks who are wanting to work with bilingual individuals within the organization recognize how to work with them effectively, but also folks are getting borrowed all the time from other organizations. So establishing some sort of memorandum of understanding so that we're all communicating, we all understand. And again, the goal is there to have good outcomes for our families. So that brings us to scope of work number 2. So we started having these conversations. We were actually able to get started on some of that policy development within that first scope of work. This piece was to really define and implement that policy and provide training around it. So again, we completed the language access policy along with supporting documents and systems. So it's not just, here's our policy, dusty page that lives on a shelf somewhere. What supporting documents need and what systems do we have to incorporate? Again, training staff about what those materials are, and then delivering the training. And so a really, really big piece of that was, again, this NASPO agreement. And so the beauty of NASPO is that it provides 24/7, 365-day support for over 200 languages. So anybody at Lake County DHS can pick up the phone and I need Polish, I need Russian, I need Urdu, I need Farsi, whatever those languages are, and they're able to have those services. One of the biggest barriers from being smaller organizations is that these language service providers, you don't care or work with them, you're little fish, right? They're not Denver Health, they're not gonna bring in the revenue. So they do have a lot of these minimums set up so that it makes it a little bit more appealing for them to be able to work with you. So there was a monthly minimum fee, and there was a minutes fee, and there were all these minimums that made it just really challenging for any organization that wasn't a big system to get access to those services. So NASPO takes care of all that. We started out with 2 vetted vendors. I think it's up to 3. The initial addendum only provided support for over-the-phone interpretation. Now there's over-the-phone interpretation, video remote interpretation, and translation. So really, any one of these vendors can be your one-stop shop for language access, which is fantastic. And I always recommend this as a basic setup, but it's not gonna meet all your needs, and we'll talk about that a little bit more. But we got that done.
I was just gonna mention on that, I'm glad that the state, unfortunately, it's like we don't have access to this contracted service.
Did you
In the
look into
municipal
it?
court,
You did?
yeah, because the municipal courts aren't covered by state contracts. So, yeah, because the per minute requirement, we had to use this once, we didn't have an interpreter, and it blew our
Oh, yeah.
year's budget on that one case to have an interpreter through language link. So kudos to y'all for negotiating that and getting that in place, because it was cost prohibitive for everybody to use.
It is very much so, and I wonder what could be done from.
But that's, I'm talking about the
The
Chief Justice
differences.
of the Supreme Court to
Mhm.
say, hey, this is, for your other community courts, this is an essential service. So we'll see how that goes.
I wonder what we can do there, yeah. But yes, again, this is
So
not for
I
everybody.
bring that up
Yeah.
to say, if you happen to be in the room with the right people to talk about that,
Mm-hmm.
if you could bring it up to say, in order to properly serve our entire community, we need it not just in the state.
Do you wanna tell Nadia about your other role?
Well, just I'm the municipal judge for the
Okay.
city of Louisville too,
Okay.
so that's why I'm like,
Yes,
understand with these.
yes, if we
Yeah.
could do it here, let's look at how we can
And
do
have
it
for
somewhere
the
else.
whole
It should-
community, because
absolutely.
it shouldn't be
It's a good
different
role for
services
Angel.
for
Absolutely.
everybody. Yes,
Absolutely.
exactly.
So we went through that process. I sort of pre-screened and pre-vetted everybody, even though that was already done. But I think it was really important. You tell me, Janine and Kristen, how helpful that was to you, because as folks, that maybe you're not familiar with shopping for certain things, I kind of liken it to me going to like a computer store. I don't know what I'm looking at, right? So it's helpful to have my husband there and be like, this is what it is. Like, I'll ask him for a USB cable and he's like, what kind of USB? And I'm like, a USB cable. So anyway, I explained like what the services were and what that meant for their day-to-day. And so based on the information, they made a decision on that. And we were able to select a vendor, which was Language Link, got them all set up, and again, had those systems and processes in place for that. And so that brings us to scope of work 3, which was, okay, we have the policy in place. Things are going there, but I think our staff still need a little bit more technical training there. So this was, again, just going back to, and again, giving kudos to this team to say, it wasn't a one and done. It was just, the approach is just continual quality improvement, which is wonderful, continual refinement. And this, I think, really allowed folks to stay engaged within the process, not, come up to barrier and be like, well, that didn't work, I'm going back to the same old thing. So it's just really a really responsive approach. So in this one, we did some more training, and in addition to, okay, we have all those services in place. As staff, I'm still not sure how I can better support my clients, because I don't understand their reality, their part of the world. Like, why are they here, and what are some of the challenges they face? So that's why we also did another cultural training, again, and this was all informed by staff request. And so up on the screen, and I apologize that it's not as large as I'd like, is I'm sharing the mission that is in the policy, because I think it just is really important in the way that Lake County decided to approach this, and seeing families as an asset and not approaching language differences as a deficit. And that's why we choose to use linguistically diverse instead of limited English proficient. And then just the components of the policy and the training was, again, looking at those legal backgrounds or requirements, the definition. It also had a section on an interpreter waiver for times when you do have a qualified interpreter. I like to use myself as an example. I'm a professional interpreter for 20 years. And when my dad needs interpretation, he wants me to interpret for him. And so there should be a way for us to support families in that desire, right? So this interpreter waiver allows everybody to be on the same page and understand the risk of having somebody who isn't being hired or staffed for that, function in that particular time. Considerations for bilingual staff. And then we also developed a hybrid code of ethics, if you will. So because of the unique work Human Services does, they kind of dip into the realm of legal, but there's also some healthcare there. So we wanted a code of ethics that kind of encompassed both of those. So we looked at the Judicial Branch's Office of Language Access, or OLA, which I think is just kind of fun, and also the National Council on Interpreting Healthcare Code of Ethics, and pulled elements from both to create the code of ethics for Lake County Human Services for both their staff and the interpreter network. And along with that, again, we need to have steps and procedures for how staff are actually able to do this. Somebody's talking in front of me, the policy's right there, that's great, but how do I provide service in the moment?
And although, I'll just say that we all believe in this, like putting it into practice and making sure that we're making it available and promoting it to everybody is a shift. I mean, so that's part of, we're actually, the next meeting we have after this is an all-staff meeting where we're talking about trauma-informed approach and language access as really our work at, and implicit bias, and how that all shows up. Like, how frustrated do we get in these moments going, I don't have to do this, or what is that about? And just being able to process.
And briefly, I will say, and I do like to share, over my 20 years of interpretation, every time I've physically come to an encounter, because I support over the phone and remote, but whenever I'm seeing two individuals and there's that language barrier, there is a physiological response that's happening. People's eyes are dilated, some people are flushed, people are visibly agitated, and it's only because they can't communicate. The minute I get there, and this is one of the things I love, why I love interpreting and why I'll do it for the rest of my life, all that diffuses. Everybody takes a breath, everybody feels better, and that is the endorphin, that is interpretation, that I make a difference every day in somebody's life. But there is a physiological response, and we can't help but have that. I've had that. I picked up the phone and somebody was speaking Russian, and I'm like, oh, I've been doing it for 10 years, and I'm like, oh my God, what did I do? Breathe, breathe.
Yeah.
So yeah, there is all those things that are happening that just kind of, further complicate and color all this. So the cultural training, we also did a survey, because I wanted to know, what does that mean? What do staff need? What are they wanting related to that? And so we did a quick Google training, and folks just really wanted to know more about the different cultures and how culture influences communication. Mostly they wanted to know about immigrants from Spanish-speaking countries, Latin America. There is a larger presence of Mexicans here, but in recent years, again, we've seen an influx of Central and South Americans as well too. How are they the same? How are they different? What are some of those drivers of migration? And I didn't want to only focus it on now, but just historically. And what sometimes is called, migration is really folks that have been here for centuries, but just the border moved on them, right? And how we kind of look at that. Resources, and then just some countries that were kind of called out in that survey that we just took a minute to kind of explore. And that was super, super fun to be able to do that. And I think staff really just appreciated having that information presented. And so now this brings us up to our current scope of work, which is again that further iteration, further refinement and implementation of the revised policy, and then the interpreter network grant, which is really exciting, but also kind of super scary. So in implementing the existing language policy, we're hearing from staff that the policy is great, but maybe it's not working within our specific context of what we do. So what is it? How do we need to dive into that a little bit further? What additional resources do staff need? What additional tools do they need? And how do we create a more culturally appropriate customer service? And then this other really big piece was creating a local trained interpreter network. NASPO is fantastic. Having Language Link available 24/7 is wonderful. But if one of the staff members at DHS needs to go do a family visit and it's in an area of the mountain that gets no cell service, that's of no use to anybody. I will say that as an interpreter, interpreting over the phone for a group of 10 people in a room is really hard. It's much easier to do that if I'm there in person. So having those folks locally here who are able to support that, let's look into that and let's create a network if possible around that. And then the final piece of this project is what we're doing with you folks today, is just sharing that work and hoping that this has a positive ripple effect across the community and across different agencies. And so just a quick overview of our process. Again, there was also additional staff requests. We're like, we need more. Looking at the grant and using a more data-driven approach, we did the full DOJ assessment for this one, and we looked at, again, things that are kind of minutiae on the back end for the organization, but I think this helps better position Janine and her team moving forward. And we would never hope that you would have the feds come looking at your organization, but if they do, we have checked all the boxes that they check when they're going in through and looking at an organization. And again, the goal was to create this role-specific training for each of the units. So when we did that more in-depth training, we continued to see some key issues, and again, that was related to challenges and barrier, particularly with bilingual staff feeling overwhelmed, and we found out that language link isn't perfect. I was surprised. It happens, we're all human, you know, and just, we need continual refinement. And again, that need for sort of a consistent wide process. We had tried doing something a little different, and there was some confusion about like when to work with bilingual staff, when not to work with bilingual staff. Again, seeing still that need for interpretation. And then beyond that, aside from what we're doing as, you know, Lake County DHS staff, what are we doing for our community? So that also came up in the surveys. Some of the staff recommendation were, again, they just wanted more learning opportunities, a consistent plan. It was confusing to have sort of different scenarios, and then more language support. And some additional feedback that we heard was clear guidance, like really make it clear, really make it easy to access, dig a little further into each of the needs of the community. And then we also heard feedback about like, well, what does this mean for other sort of DIA funded opportunities? And what does this look like? Maybe even be, you know, a step back, a little bit more upstream in terms of HR hiring practices. In addition to looking at what the staff thought, what those challenges were, I pitched it to Janine and Kristen and said, well, how about asking what our communities feel? How are they, you know, because we're not gonna know if we don't ask, right? We could kind of decide, you know, and think this is what we need to do, but if we're not asking our community members, how do we really know? And so we did do what I hope is the first of a set of key informant interviews and talking to community members in their language and saying, hey, Lake County's doing this. What has your experience been? And again, not surprisingly, language barrier came up as a challenge. And folks just wanting more information, like they didn't know. And there's a lot of uncertainty related to government organizations. Like, I don't even know what that does or if I should get anywhere near it. So those concerns there, again, related to their immigration concerns. And there was like some prior negative experiences, and how do we address that? So some of their recommendations were to provide more information, and they felt that it would be helpful to have somebody like a neutral party that can help them understand and navigate these sorts of things. And so from my consideration as the consultant on this, just really wanting to advocate for a consistent practice and approach across the organization. And then based on all the information that we gathered, looking at it and say, what can we feasibly address within the scope of what we're doing now, and what our other organizations, you know, like DHS can do in the future. And so that was assessment. We went through many iterations, several sheets that looked like this. We had a cumulative one and then the leaders matrix, because we wanted this to be an involved process. We wanted people to hear heard and informed, and I feel that we really did achieve that. And so now we did the updates to the policy, and we won't walk through all of it, but we will go over just some of the key differences. And so some of the key differences is that as a department, staff are going to rely on those contracted services first, and they will only reach out to bilingual staff for appropriate secondary support. And that's, you know, making sure that the bilingual staff is able to only act as an interpreter. They're not going to be doing two things at once. But ideally, when the network gets set up, even those should be less. So we're trying to transition folks away from like, you know, hey, you know, whomever, come and help me, drop what you're doing and come help me, and really get folks just to that point to where they are able to rely on those services. But some examples of what might be appropriate support would be maybe longer meetings. It's going to be really tough to be on the phone for an interpreter for an hour and a half. Even the interpreter gets tired. That's hard, right?
Yes.
Again, places where cell phone access isn't available, or just certain situations where, you know, it just really makes more sense to have a live, you know, body there. And another thing that came out through this was, again, that confusion between in-language communication and interpretation, because we had staff members, other asking bilingual staff members, hey, I had a call from such and such client, call them, email them. And we had to remind people that interpretation always requires 3 people. Your provider, which is usually the folks from the organization, your client, and then the interpreter. If it's any less than that, it's not interpretation. And so that was an important distinction, because staff members are like, is this appropriate? Should they be? And I really want to just take a minute to say that I'm super proud of staff that felt empowered enough to say that, because a lot of time bilingual folks don't, and they just do that. But they started asking questions, like, not in a mean way, not like I don't want to help my coworker, but is this something I should be doing? I don't understand how this works with the policy. Just having that reminder and having those conversations with staff members again about what interpretation is and what those appropriate requests are. Another, I think, really big change, and I hope a big win for this latest iteration, is that we created a cheat sheet, because it was just too cumbersome to have to go look through the policy to find all that information. So we created a one-stop shop, and it breaks it down to each of these sections, like how to access Language Link. What are some considerations that you should do before talking to your client? You know, how to brief your interpreter, you know, warm them up, because interpreters go from insurance, especially if we're doing it over the phone, insurance conversation, OBGYN visit, mortgage call, and then boom, we're wherever you are. We don't, you know, we need time to kind of load those word banks, if you
We
will.
can relate.
Yeah, right? Yeah, wait, let me get my feet under me here. So again, having some of those best practices that just support really good communication. And again, being really clear on when do we call our bilingual staff members and when do we call our contracted folks. And then with the memorandum of understanding, because we have these systems and infrastructure in place, it became apparent that with the creation of the bilingual staff request form, that was already kind of baked in, and that really the memorandum of understanding only needs to be utilized if a staff member is requested for interpretation from an external organization. Just put the interpreter waiver in a different place, put some more clarification around document translation, to Janine's point, again, really spelling out what vital written documents are. And for those situations, like when a family just got out of court, they have to respond to something that's in writing. It's not appropriate to ask the interpreter to read those 5 pages. That's called sight translation, and it's a really heavy neurological lift. But it is appropriate to either have an interpreter, you read that out to the interpreter, whether they be over the phone or right there in person with you. So that's kind of how we make sure our community members are informed when we don't have those documents at the ready, because it's not feasible to say that you're gonna have every document in every language at the ready, because documents are changing all the time. So that was the approach there. We also updated our quality assurance form from being sort of a complaint form to really wanting to be, hey, this process of continual improvement. And one of the big things and the big differences that we added there was, in addition to, hey, this went wrong, we had an issue there, really looking at interpreter well-being and considering things like vicarious trauma. So if you were working with an interpreter and you feel that because the subject matter that you talked about, some stuff could be really, really rough. And you just saw that interpreter was wilted, if you will, after the interactions, reaching out and saying, hey, I think our interpreters may need support. And then this isn't part of the policy, but we worked it in as part of this cheat sheet, was what additional resources could staff members have to really understand diverse communities? So we created a whole folder on different resources for just understanding that immigrant experience, and that they're able to access that. And then the next big piece was that interpreter network, which was in development at the same time. I'm gonna pause right there. Any questions?
Some of the things we came across, and I don't know if we get to this, but just in terms of that quality assurance, were things like interpretation during a child welfare interview, and our staff member saying, the interpreter was monitoring, I'm interviewing a child, and I'm trying to explain that and kind of set that up, and the interpreter's just monotone and straightforward, and the kiddo's like, what is this, and what's going on. We had other times where an adult protection case, and caseworker said, this interpreting over the phone is not gonna fly with this person. They don't know who I am, I'm not trusted, and this is not, but showing up with someone to their home who speaks Spanish, and we can have this in-person interaction, all the difference. But yet we have to prepare that bilingual staff member who was requested to go out. There may be some unsanitary conditions in this environment. There may be some drug use that has been going on. So yeah, but we'll get into what all of that looked like, but it's just one of those things that we have to everyone is different.
Mhm.
Absolutely, yeah, and it's a continual learning process, which is
Yeah,
wonderful.
learning what to prime folks with and also learning what to ask for.
Yep.
To be prepared.
And the quality assurance is also giving feedback to Language Link.
Yes,
And saying,
absolutely.
so one of our staff members said, I couldn't understand this person's English.
Right,
Their English, and it was very hard to understand. Or they were not able to accurately interpret the legal words that we were using. And so that's where we keep going back and saying, okay, let's fix that. Let's work with,
And so that feedback allowed Lake County to say to their vendor, Language Link, take us off the social interpretation pool and put us in the legal interpretation pool, because you could go
yeah,
from a very social conversation to a very legal conversation within
yeah,
the same dialogue. And so from an organizational perspective, they said, no, we just need to make sure we have legal folks who are able to do that all the time. Those calls would not be coming to me. Alrighty, so the interpreter network was simultaneously the most exciting and the most terrifying piece of this project for me. I was super excited. I knew this sort of effort was needed and wanted through my work with COACT, because this is the feedback we got from rural communities all the time. There are not enough or any qualified and trained individuals within our community to provide this on-site support. I was thrilled about it. And I told Janine later, I'm like, this could either go horribly wrong or it could be horribly right. And my biggest fear was that we would not have a response from the community. And that was quickly allayed. So we did promotion, we did presentations, and we did interviews and role plays, and we provided these information sessions to community members, and we started getting feedback from the community. And that was absolutely wonderful. We had a total of 19 people interviewed, and through the interview, some key takeaways that I want to share with you is that most of these folks are bilingual, and they've been working or acting as interpreters, but they are not trained. They are emerging interpreters, and I would say 90% of them started interpreting for their families as children. And that is something I can relate to, but at the same time really makes me want to cry now that I'm a parent, because I think about asking. I have a 14-year-old and two 11-year-olds, and I started interpreting way before I was 11. And just the burden and the terror that I would ask my 11-year-old to help me fill out a form, or help me understand what a doctor was telling me, or help me understand what a lawyer was telling me, at the end, kind of made me want to cry. And that's just something that I want to share with you all, because let's not do that to our kids, right? For those of you who are parents, how many of you want your kids doing these things for you?
That's heavy,
Right?
yeah.
Right, so I would say 90% of us, of them were interpreting as children. And again, these are emerging interpreters. Let's support their development. That was something that we were so on the same page with from the very beginning, and we worked with folks like Gloria, and we talked about experiences where as a community, this had been attempted before, and all the reasons why it didn't work. So we were really going in there, keeping that top of mind. And I was thrilled that we had any response from the Spanish community, but then I was blown away and just excited that we had 2 Polish speakers come forward. So that's fantastic. So we did, again, having these folks receive the training that they need to support them where they are in their journey was super important. So we developed a 101 training, which is really kind of meant to educate folks about, like, what is interpretation? What's the difference between being bilingual? What trainings are there available? What does language proficiency testing look like? So we did a session for external folks and also staff. And coming up, there's going to be Bridging the Gap certification, which is a 40-hour certificate that's just going to further support these folks. It's going to, again, go over roles and ethics, more role play and that sort of thing. And so hopefully by the end of July, we'll start booking folks and sending them out on assignments, and that's very exciting.
Before you go on that,
Yeah.
Bridging the Gap, is that the same certificate program that will allow them to be certified court interpreters?
No, great
Because I was
question.
gonna say, if we can find some way to encourage them to go beyond that, I was able to convince city council to include in my budget for this year scholarships, if you will, to pay for those certification
Right.
classes. If we can identify people who want to become certified court interpreters, so we can grow our own here in this community.
Absolutely,
that'd be
so
great.
needed.
So
So this
keep
is,
that in mind.
yeah, this is for medical, and the court system, the Office of Language Access has a whole
Different one.
different thing, and I'm happy to share that information as well too. That's beyond my skill set. Like, I'm
Yeah.
totally comfortable in the medical field. I will talk about, blood and guts all day. The legal stuff scares me.
Yeah, but if y'all do identify folks who are going through this
Yes.
program that
Yes,
want to go
totally.
to the next step,
That's
because I
our
mean,
goal.
we pay $45 an hour for interpretive
Yes.
services.
So that's our goal, and we'll talk about that. One of our goals within the interpreter network is to develop an individual development plan for every interpreter. And so they get to identify like where their skill set is, where they want to grow, and what their goals are. Whether it's, and Maria has the capability to help people connect with that opportunity nationally as well, so that they could become, this is a new concept for folks to think about being a contract interpreter as a living full-time. So we'll talk about what that training looked like for them too. I also right here just want to emphasize that we are now treating our bilingual staff as part of the interpreter network, which means they aren't pulled in at the last minute to ask to interpret for anything. They are currently our go-to interpreters because we're having everybody else go through this training. So for our staff who need an interpreter, they have to put in an official request to Kristen for an interpreter. And then we reach out to our bilingual staff and find out, will this work for you? Will that work for you? And then we're figuring out what to do if it doesn't work for either one of them. Again, our policy says first use Language Link, but when that's not optimal or it's not going to work, you put in this request. So we're sort of initiating this network process internally by putting in these requests to our interpreters. And all of our bilingual staff went through the interview process. We have an interview, an application, they're doing a background check. Our staff have already done that, but anybody outside does a fingerprinted background check. And then we'll be going through this required training. Then they'll have the individualized development plan, and we can pay for the Bridging the Gap, the certificate, and future training with CMC that we also have. So the legal training could also be a part of that, but our goal is to offer the training for this or CMC enrollment. So just so you have a feel for that, like the structure is that they're technically contractors for the interpretation work. So we're in the process of setting that all up too. We need to get contracts set up with each of them. Right now, we're doing it as either overtime or bonus pay when they are taking those jobs. But they could be contracted, for whoever is reaching out to our network for those needs. And the MOU process could be for other county agencies or other outside organizations to utilize the network for that. And my vision is that all of our non-staff interpreters as well, that we start becoming specialized, and particularly in human services. And so the other county departments of human services could say, hey, I need a Polish-speaking interpreter for this child welfare interview. And that could be a side job on a contract basis for our Polish-speaking staff.
And from a sustainability perspective, Lake DHS is setting themselves up as the agency, the Language Access Agency. So this provides that backbone, that infrastructure, that support that's needed to sustain linguists, because that was one of the key barriers identified before. But additionally, this could potentially turn itself into a revenue generating avenue for them for sustainability long-term too. So, opportunities there. Alrighty, so I do like to spend a little bit of time on what interpretation means and why with the interpreters we spent some time sharing this as well too, just giving them an overview of the profession, the field, and the credentials needed for their development. And then I think it's often overlooked at what a specialized skill set interpretation is. And I'd love to share this quote from the Geneva Brain and Language Lab, because it really just underscores the neurological tasks and strain that somebody who's acting as an interpreter needs to go through. And so when we talk about somebody that's bilingual, that's fantastic, But when we talk about somebody who's able to interpret, that's a completely different brain function. And so I come from a bilingual family and my sisters all speak Spanish, but whenever somebody needs to be interpreted, they're like, that's your job. We don't do that, and they're fully bilingual. So I always just like to share this one because I think it just helps us understand what a specialized skill set and ability that is. And then in addition to that, to having that innate skill or that developed skill, I think it's often overlooked that interpretation is a profession, but I don't think we get the recognition as a nurse would or as an accountant would, even though it's one of the oldest professions in the world. From the moment two people didn't speak the same language, there have been interpreters. No one always called that, right? But there have been interpreters. And so within the linguistic field, there's 4 main branches: conference, healthcare, legal, and educational. And I also like to explain the difference between, again, language proficiency and that interpretation skill. And the ILR, which is the International Language Roundtable, has these wonderful scales. And if you ever get a minute or are curious, please check them out. And so on the linguistic, the speaking skills, that scale goes from 0 to 5, and that 5 is somebody who is a skilled native person. So if you think of yourselves and your roles where you are now, you would all be 5 for English, right? And then when we talk about interpretation skill, again, 0 is no skill, and 5 is a master performance skill. And for me, 5s are the folks that are interpreting at the United Nations. I've been interpreting for a very long time. I flatter myself to say I'm pretty good at what I do. I'm within the medical field. But whenever I look at this list and these categorizations, I never have ever labeled myself a 5. I always give myself a 4. So it's just a good way to check. So it's super interesting. Please check them out. And in terms of like the training related to the profession, there's a certificate programs and being certified. So certificate programs are like the Bridging the Gap, which we shared, which is a 40-hour training. And then there is the certification. So if you're a certified interpreter, this is more akin to sitting an exam, similar to what a nurse may have to sit, similar to what a certified public accountant. There's a proctored exam. You have to renew it every couple of years. So I always like to give kind of this context because I think as a society, we tend to undervalue interpreters and don't understand that, you know, we pay these higher costs because these are trained professionals, just like you would pay an electrician or a plumber. So I just like to kind of give that for context as well too.
Is it both maybe, or do you mean the certification is for the interpretation or for the like content of the field and
Yeah.
the interpretation,
I
like
was just
depending on,
gonna
because I know
add
there's yeah,
Yes.
I mean, I understand that there's medical and all this, but
Right.
I would assume that you need to prove some sort of like understanding so that you can navigate that.
Absolutely. So the certificate programs, and the ones I'm most familiar are within the medical context. So Bridging the Gap is a medical one. There's another one called the Community Interpreter. That one's more general, sort of social, but within the realm of being certified, particularly from the legal perspective. So these 2 national certifications are for healthcare. There is no national court certification, but every state does have specific requirements that you have to meet to be a court interpreter. So Gloria did undertake that process, and she didn't make the top rank, so she's not certified, but she's something right below that, qualified. So those are those differences. Does that?
Great, yeah.
And just so you all know, while we're having folks go through Bridging the Gap, and it's a medical interpretation, the purpose for that is learning interpretation skills.
Yes.
So it doesn't mean that they're going to necessarily be interpreting for the medical field. What it does is it says things like, here's some vocabulary, and here's, you know, so it sort of grounds you in how you interpret for something. Do you want to talk?
Totally, and beyond that, it's really the rules of being an interpreter. What are your code of ethics? What are your practices? What are the techniques that you use as an interpreter? What's appropriate, not as appropriate as an interpreter? So it really is how to be an interpreter. And again, the reason we're going with medical, because this is one of the most widely recognized and available ones. And there are others out there, but this one also met our timeline.
The other thing is, our goal is to sort of develop that specialty of human services interpreting within our network and utilizing Maria's skills, but also have the interpreters develop their own, like, what is the vocabulary we're gonna use? What's the best interpretation for
Glossaries,
this terminology? And this comes from years of bilingual staff coming up to us and saying, I was asked at last minute to be thrown into this child support interview. I don't know what child support how I interpret the words child support,
Right.
or, it's sort of like, give me a fair shot at doing this well.
Yeah.
Because imagine how stressful it is to be like in the moment, at that moment, you're trying to figure out what words to use to convey this language. And that's tough.
Yeah, I can appreciate that.
So the goal is to really strengthen that and develop that specialty, whether that specialty is within public assistance and talking about Medicaid and the Affordable Care Act and TANF and, these things, or talking about child support, or talking about child welfare, or talking about prevention focus. And what we've really heard in these interviews with all these interpreters is they love being bilingual, they love helping the community, and they want to grow
Yes.
in their language skills, both English and Spanish or whatever, that they want to have experienced less of that stress
Yeah.
of not knowing what words to use in those moments.
And then-
Sorry, I'm laughing because I'm like, I think we still do that in English. I'm like,
Yeah.
oh my God, how do I say this?
Yes,
For the 8th time in a different way so that it's processed.
That's totally a valid point, because we use these terms in our day-to-day language as English speakers, but I certainly don't put a lot of thought as to what that actually means. And we have so much, letter soup, alphabet soup, word salad, right, that
Yeah.
we use,
Yeah.
and we really don't know. So yes, all that developing and supporting.
So the other piece of that too, that I really want to emphasize, and our focus has been, how do those of us who are utilizing interpreter services do a better job? How do we not use idioms and phrases
Jargon.
and acronyms and set the situation up for success and pause well? And so we throw so much on the interpreter and just expect them to be able to go with this without recognizing there's a lot we can do
Right.
to make this go better.
Yeah.
And there's no training out there on that. There's nothing that says, here's how you set the situation up for success.
Which,
So-
brings us right to perfect segue, Janine, into this slide, is that, there are a lot of challenges, and we talked about that lack of training, the lack of workforce that's bilingual, bicultural, and again, the lack of understanding both among the linguists and the professionals that they're supporting on how to, reduce the risk, navigate that nuance for effective interpretation, and also lack of understanding around certain topics like human services, but also mental health and how that can have an impact in the form of vicarious trauma or secondhand trauma to interpreters. So really quick, because I know you guys have been so gracious with your time and allowing us to share this, I'll go through what we did with the Interpreter Network. So it wasn't just, are there people, are they interested, are they available? We need to help them understand how to be a freelance interpreter, because there isn't a course on that either. It's, kind of figuring it out yourself, but let's not have them jump through those hoops. Let's provide the support for that. So again, Janine talked a little bit about having the contract process in place and making them aware of that, how the scheduling assignment will work. So DHS will work very much as a language service agency in that they will receive requests and then they will assign those requests out to the interpreters based on interpretation skill level. Folks are coming in to this at different skill functions. Again, some are just very bilingual, no interpretation skill. We did a role play. They broke a lot of the rules. That's okay. We're going to teach them about the rules because they didn't even know about it. And so we're going to group folks based on the assignment, because it's not the same thing to ask somebody to show up to the front desk to fill out a form than to visit somebody's house where there could be potential other stuff, that they'd have to manage. It'll be first come, first served basis on their part. Again, they'll have to act as a freelance interpreter, checking your email, checking your availability, accepting assignments, and being responsible for those assignments. Invoicing, they'll have to submit an assignment sheet daily, weekly invoice, and then the pay is every 2 weeks, paid via check. And then again, just having them understand what being a freelance interpreter is. So having them understand things like, are you gonna do this as an individual or an LLC, and understanding the risks there as well too. It's super easy to just report it under your social security number. That does come with risks, and LLC does require a little bit more of your time, in my opinion, well worth it. What are some tools that you can get yourself organized? Google has been the reason I was able to start my own business, because they're all free, that sort of thing. And other considerations like taxes and expenses. I had a friend who was an interpreter, didn't realize that she had to put away taxes and got a letter from the IRS, and that's kind of scary.
Yeah.
We don't want folks to kind of have to deal with that. So that's everything in a nutshell. I just so appreciate your time, and if you have any other questions, please let us know.
This is great.
Kudos to you.
Yeah.
Yeah, that's a lot of work.
Yeah, we're really excited. Our asks of you all as we go forward. So in our next grant application, we are going to ask for an interpreter network coordinator position, which Kristen has very graciously been filling since, because as we're sitting there doing it, we're like, who's gonna take this interpreter request? Who's gonna set up this? Who's gonna, and so the interpreter network coordinator, we envision, will be the funnel for all the requests. So they keep track of everybody's schedule, everybody's availability, everybody's testing and skill set, and can say, here's a fairly tricky child welfare interpreting request that's coming in for 2 days from now. Who would be the person to assign this to? Who do I know could handle it?
Who could be impartial, given a small community?
Right. And what can we do with that one, and all of that back and forth. That's one piece of it. The other piece of it is collaborating with Maria for training. Where our envision is that every month we have a training. And we have what's called the, what do we call it, Conversation Cafe?
Learning Cafe.
Learning Cafe,
Yeah.
where it's role play, it's sit down, it's engage, it's get to really dig in, because that's what they all said too, is like, I need practice, I need
Yeah.
a safe space to do that, I need that feedback, I need to have somebody say, don't forget, you need to.
Introduction,
Yeah,
your clarification, remember
Right.
that role, yeah.
how to do that, and get comfortable, because it's not natural necessarily. It's not like just a conversation. It's like, pause just a moment, could you slow down, these kinds of things that we typically wouldn't do in conversation. The other part of that, is developing that individual learning plan with each interpreter and following them through that, recruitment of interpreters, QA work, taking all that feedback on how is it going, both with our language link, but also with our interpreters, growing that. And then also being able to interpret, so that we envision that the interpreter network coordinator is also an interpreter. And so when there are gaps that we can't find an interpreter for that moment, that situation, that they're able and skilled to be able to go in and do the interpretation, and then also learn, oh, this is what's needed in these kinds of situations. The goal is eventually we have a strong enough network that they don't necessarily need to serve as the interpreter, but it's also helping them grow as contractors too. So is this weirding people out that they're a contractor? They don't quite understand what that means versus a paid hourly job. What are the goals of this person? This person is a full-time mom and would love to become a full-time interpreter and make $45 an hour. And what could that mean for their family and for their budget and those kinds of things? So this person who really supports the interpreters, understands what needs they have around vicarious trauma training, what topics need to be addressed, how do we need to bring that in? That's way beyond what Kristen has done as a project manager for the grant. So our goal will be a full-time position that we are gonna ask for with grant funding. And we will hopefully also sustain that long-term. The second position that we will ask for in contract work for the grant would again be to bring back our vendor for all this training, consulting, development of the network. And then the other contract position that we will ask for in the grant is a sustainability coordinator who will look at all the funding opportunities for this work. And they're out there, but to really sit down and research them, whether it's a workforce grant, whether it's working with the EDC to say, what if this becomes the next economic development for Leadville and Lake County, and we develop an interpreter network hub with a call center or whatever that looks like.
Your own language link.
Yeah. So the other thing I want them to do is look for funding and then help us develop what model is going to work best for this network going forward. Does it become a county department of its own? Do we incubate it for 2 to 3 years, but it becomes its own nonprofit? Does it become a business, a for-profit business? What models are out there? Because all of those exist. There are nonprofits, there's businesses. What's the best model for both this community, for the interpreters? Would interpreters love to be full-time employees where they get lots of benefits and there's an on-site daycare, and that's our vision for what this network looks like in our community, and we become a hub that's specialized or whatever that means in some way? Or is it a nonprofit, or, you know, what does that look like? And that contracted position is responsible for producing recommendations on that for a long term. So our request is really to sort of support this work, continue growing our staff. The other request is that the fabulous bilingual pay differential, having an interpreter pay differential, and then maybe requiring that those folks that are getting that interpreter pay differential are part of the network. We asked that everybody be willing to interpret for Human Services Department to be part of the network. So we have like a library staff member, public health staff member. It doesn't mean it has to be a lot. So it could be something like, hey, we need some health coverage on your afternoon off in the public assistance office at the front desk or something like that. This has been a huge education process for me, even as I think, oh yeah, we'll have a staff member translate this, or we'll have a staff member. I can just give you some examples. You know, a child welfare caseworker that says, this document is a court document I'm submitting in English to the courts, but my client is Spanish speaking and only reads in Spanish, but I'm submitting an English document to the court, but this person can't read the document I'm submitting that's all about her, right?
Yeah.
So what can we do for that? So we had gone with paying for translation of the 5-page report for about $500, or do we ask a staff member to translate that, because it's not official court material, it's the report of how the case has been going. Or is that a vital document? So what we settled on with Maria's, you know, as much as you go through all this, you're like, okay, we've got it. No, we don't have it. Every single situation and every single scenario is different. She's like, what if you had an interpreter present, the caseworker reads the report to the client, the interpreter's there interpreting this court report. So it's a verbal rendering of the court report for the client, so she's informed about what's in the court report, but it takes 45 minutes versus, you know, 6 hours of a translation that's more expensive too.
And then you're creating a condition, which I hope is a little bit more conducive to understanding, and if the client in that moment has questions or maybe disagrees what's been written in there, it's an opportunity for them to kind of have an in-the-moment response. And I mean, the things have come up, I don't necessarily have an answer. I'm like, well, let's think through that. Like, how can we best support our community, our clients in this situation now, and what can we do to the future? So for any of us doing this work, it's a learning process.
And then we've had conversations like in our child support unit, all these forms are in English. Or even if some of them are in Spanish, you know, what, do we send them home with the client and say, have somebody help you fill this out?
Which happens.
Or is it our requirement to go through that with an interpreter to help fill out those forms? And you can just imagine staff going, do I have time for that? Where am I gonna fit in? How is this gonna work? I have to put in a request for an interpreter now. And the bilingual staff has to determine, I don't know, could I take that request? Is that my lunch hour? Do I have time to flex my schedule? So we work with supervisors. How do you want these requests to be handled with your staff? Do you have time to do this? It's totally okay to say no. And then, you know, it's up to us to figure out. If you say no, it's up to us to figure out how that resource is going to be met, and then develop and grow this resource so that those needs are met. So there's just, in a few months when we rolled this out, we're like, okay, here we go, and the things that, and then for staff to get in the habit of, you know, you don't reach out to that bilingual staff member yourself, you fill out this form, and then you do some QA reporting on how that went, you know.
We just rolled out real quick VRI, and there was the high fidelity wraparound unit that was just having challenges with, like, the phone just doesn't work. And VRI means video remote interpretation. and they were stoked, and the second we did the training, Kristen had a request. Now these staff members feel empowered. I can do my work, I don't have to wait, you know, so it's just been wonderful, really rewarding.
And I think, sorry,
No,
on
go,
the side
absolutely.
of the staff who need to put the requests in, we have consistency across all of our units now. They know what they're supposed to do. And whereas before, our bilingual staff would get an email and then a text and then a call, and now we have like one
Centralized
funnel,
process.
one channel, yeah. And I just think that that's like created some relief to them. And it's definitely, we were joking about this. I was so excited that the two staff that we probably over rely on
Put a lot of requests in
yes,
too,
for
yeah.
our interpretation services, they both said no to a request, and I was so excited because like they get to say no now, whereas before, I think that they probably, you know, rearranged their whole lives and their other roles to squeeze these requests in, so.
And I'll just illuminate on that point, because as a bilingual staff member, it's not only about the work that we're doing in in that moment, we know we're supporting our communities. And I will just share a quick example where I was asked to translate a document about a boil water order because of an E. coli outbreak. And I'm not a translator, and I said I don't have the skills, and I was told, well, if you don't do it, then nobody will. And that's my community. And that's my community that's not gonna have that information. So we don't have the choice most of the time to say no, because it's not about us necessarily in our workload, it's about our communities.
And we've had staff members, bilingual staff members, be able to come back to us and say, I heard you explain how it's supposed to go, so what do we do when it doesn't go like that? Because it didn't go like that, you know, and like really uncomfortable with sharing that, but you know that it's because we have a policy in place that says this, that will, and to just keep saying we're gonna work on getting better at that, but they have to trust that we're really gonna work at getting better at that, and it's not gonna come back on them. But just, it made us aware of like, what an uncomfortable position to be one of the few people of color, and to be telling these white people around you, sorry, kind of did that wrong, or that's not really my role, and you may have different levels in the organization, and like, wow, that's a lot to put on people, so to feel that the structure itself supports them. And just also to recognize, which we have for some time, to recognize like that is your community, and you're talking about some tough things sometimes, like really tough, you know, disclosures, and being able to process that and recognize that that's a part of it. And then the goal really is to elevate that skill set too. So recognizing that this is a specialty, it's literally parts of your brain that you are trying to work with, and how many stories they all had about, yeah, I was asked to do this, or I was asked to translate or interpret in a community meeting, and everybody's going to million, like, we just have to have that value, and it's not enough to say it. It's about how it shows up in our everyday world, and the fact that we're like, okay, let's go back to the drawing board on how we're doing this, or, you know, and it's every situation, yeah. It's like, okay, I thought we got it, and we don't. And we hope that the long-term effect is on the community, and that they feel safe and comfortable, but it takes time too, for them to feel like, so those key informant interviews, we want to broaden that. One of the other grant opportunities that we're going to ask is to bring back our Member Experience Advisory Council, which is funded by Medicaid, to find out what their Medicaid members experience, but really focus on the Spanish speaking experience. And our question is, do people know that they can come into our office and not have an interpreter with them? Do they feel like I'm going to be able to walk in there and get all my needs met in a way that I know I'm going to feel safe and comfortable with, without having to bring someone? And the answer right now for some people is no.
Well, and I'll just say that while, again, the majority of the need centers around the Spanish-speaking community, I was just thrilled to hear that there was a family, was it High Fidelity Wrap Brown was working with, that spoke Russian? And again, this family, the daughter was relying, or was being the interpreter, and the mom would rely on the daughter, and the staff member asked, can we get an interpreter for you? And what that did for that family in that moment. So while it's, understanding the needs of the larger community, this elevates all community members that again, may have a different preference.
Yeah, totally.
Yeah.
Awesome.
Great.
Yeah, so that's the direction. Are there other asks that we had? So staff, we'll seek out the funding, other than like my time I'm committing to it. It should all be paid for by grants. I think, so staff, the support, but then also willingness to continue to engage in the conversation, like interpretation, translation, bilingual, what does that mean? And then within the county, to even ask, when are bilingual staff getting asked to do things, which again, they may or may not mind. That concept of risk is really important because we tend to minimize, even our staff is like, oh, we're just telling their kiddo what time they should bring something back, or what, and it's like, what if they transpose the numbers, or what they're asking their benefit amount, but what if that
mom's waiting for their kid to be able to get out of school to even get that information, right?
Yeah.
So it's things like that. And then to me, that is also the heart of our EDI work in this community. Like that is something we can do that's very tangible, that it's about stepping out of your own comfort level and thinking, what is that like for other people to access, and then also to live in that that work experience too. And so that's a conversation we're having with our staff as well, is to be able to just acknowledge, like, we all have bias and we all have these things, and here's something today right around you can become aware of, and you can help reduce the stress levels and the trauma impact for your coworkers just by asking, is this something you need? Or would you like to say no to this?
Yeah,
That's super cool.
fantastic.
Thank you all for
Thank
your
you.
time.
Yeah.
Yeah, don't you
Thank you for coming.
Absolutely, absolutely.
It's a lot of information to like take in one.
every week.
Session, yeah.
We're
Slides,
like,
slides you
okay.
have, if you'd like to refer to them, they're all
Yeah,
there,
that's,
so, yeah.
that's great. That's awesome.
Yeah.
Absolutely.
Excellent. What, I think that, do you need a formal support, or how
No,
are we?
well, I guess when I go to do my budget proposal and that's in there, as part of our grant work, and having an FTE that's a network interpreter coordinator, and then also, and us having that conversation of what the structure looks like. We had good conversations about, what's the best process for employees, is it contractors, or, overtime, or what does that look like, decided it was separate. I just also want to say, to have leadership that values that, like to have an HR department that it's like, oh yeah, we have to do this and we have to do that, where that's such a big piece, and we're not having to convince folks that it's important or that it's valuable. So I think just you all backing that, and so also for our leadership team to be able to recognize that. And I will be honest, and Maria was very gracious, that recognizing we have a lot of folks, including most of our bilingual staff, that are not really at the level of interpretation that we could say there's not a lot of risk. There are some practices that we actually run across within the county too that we might want to evaluate for risk. Like a provider asking a bilingual staff person to give information to a family on behalf of the provider without
Being present,
them there.
walking away.
Okay.
Call them.
So just being willing to have some of those kinds of conversations too.
I think it's absolutely,
Yeah.
you have our support.
One of the
And
things,
I would imagine Jeff.
I think the next thing, we also
Yeah.
talked about a community training on the difference between interpreting and advocacy. And do you want to talk for a second on that, because that's shown up so
Yes,
much?
so within the realm of our roles and ethics as interpreters, there is a bullet point for advocacy. Now, advocacy is not interpretation. Advocacy is you stepping outside your role as an interpreter, because despite your best efforts, you're communicating and the provider's distracted, or you know that the patient doesn't have the cultural context and they're talking past each other. And you understand both, so you're the only one that can see them careening towards the cliff. And so advocacy is when you step outside your role to say time out, something is happening here, and it's to advocate on both parties. And it's in the spirit of preserving somebody's health, dignity, and just keeping people safe. But oftentimes, particularly as newer interpreters, looking back as a younger interpreter, I remember just being really keen to want to advocate all the time because I knew the struggles that my community went through. And time and experiences taught me that that's a last resort. But again, it's just really easy to want to like fall into the advocacy role and then I'm just going to take care of you now.
Yeah.
And what that does, and I've been put in my place several times and the client said, your job is to interpret. I was like, thank you for reminding me.
I got that, I understood it, yeah.
But again, not understanding those roles and ethics and why that's important and why those things are in place is you know, the education that these emerging linguists need to have to keep us safe, to keep them safe as linguists, to keep our clients safe, and to keep ourselves as you know, representatives of organizations and organizations safe to ensure that, you know, good communication.
Yeah.
And I don't know that all of our organizations understand that they are using bilingual staff to take those moments of interpretation and either ask them to be advocates or getting feedback around that. So we are training all of our interpreters. You don't have an opinion on
That's
how
another
it
code of
goes.
ethics, or the voice.
You are not having an opinion on how this child welfare interpretation situation
Or what you
went.
thought of the therapist, or what the mother's, you know, approach to disciplining her children was. That's not your role.
Right, and it's not your role to have a conversation outside of that
And it may be
situation
hard
about
to communicate those facts of the case without an opinion. But you have
Yes.
to be able to do that.
Yes, and that's where that level of professionalism and that certification is, and literally, you don't talk about that situation after that. Nobody comes
Right.
up to you and says,
Confidentiality. Rule number one.
I wanna talk about this, and we went over that in the interview, we go over that in the training, we were
Oh,
asked
like-
it yesterday, and then.
Like child welfare staff, after the client leaves to the
Right.
interpreter, like, oh my gosh,
Yeah.
you have to be able to help me convey.
Right,
Yep.
that,
That's an inappropriate step.
or the client coming back to the interpreter, seeing them in the community later,
Mm-hmm.
and saying, help
Why
me
didn't you
with this,
advocate
why
for
didn't
more
I do
benefit
it,
for
right,
me?
right.
Yeah.
And our interpreters run across that, a teacher talking to the interpreter later saying, well, do you think DHS did the right thing in this situation and all of these, you know?
Right.
That's a boundary you set up and you know,
You're
that's a
purely
role.
there to communicate,
It is, yeah, and I
to be the medium.
for the purpose of maybe like continuing to support the development in all of this too, I think like there are so many things that you shared that I think we can all relate to at some level that maybe don't have, but like how you're, you know, knowing your audience and this and that, and then like those pieces of like staff versus decision makers or all those things. So if you, I think you have a lot of brains to pick in this room too, if figuring out how, although I'm not trying to diminish your experience, that
No, not at
maybe
all.
have all these like, you know, key, but how to, if there's ways to help make that message resonate better with other folks or
Totally.
other organizations.
Knowing your audience, you said it.
Yeah, yeah,
A key part of that, and I will say
Can be
Gloria is just such a prime example of that, is know your role. In every situation, whether it is domestic violence advocacy, community organizing, whatever it is, you come there with a role and you need to be able to, and this is what happens to a lot of folks who are asked to play multiple roles
Yeah.
because they represent a community.
Yeah.
I'm here in this capacity. That's how I'll approach this, and it doesn't mean that I can't, you know, do other things, but if I'm gonna do other things, I need to do it, you know, through this avenue or through this venue. I'm not here as an interpreter to then be going back to the community and reporting on the inside workings of, you know, something else, because you're also misusing that opportunity for the client for your own agenda. So that's something we haven't had a conversation about in our community that's helpful. And then how do you set those boundaries personally even? So, you know, our bilingual staff will tell us, you know, I get Facebook requests for this. If people know I can do this,
yeah.
I'll be asked to help with forms, to help, you know, with all of these things. How do you navigate all of that?
Right.
going through that, reminding people of that process.
Yeah, and so I'll just say, like Maria has been able to share with some of our staff, if you're being asked to interpret that, have you actually asked the workers' comp folks why they don't have someone to be able to go through that application with them instead of you taking on that liability of
The
doing that?
organizational accountability and responsibility piece behind that.
Mm-hmm.
Yeah,
And a lot of times it's people who they trust, so, even if the organization provides somebody, it's like, do I trust this? So it's about building that trust as well.
Definitely.
Well, thank you.
Thank you.
yeah, thank you guys,
Great
appreciate it.
Yes,
Nice to
very
meet you all.
exciting,
Yes, great meeting you.
very supportive.
Yeah.
This is great.
Thank you guys.
Right.
Yeah.
Thank you.
Thank you. I have to run over to
Yeah.
Right time.
meet Sarah.
Sure.
Have a great rest of your day.
Yes,
Thank
thank you,
you
Maria.
guys, you too. Is public health coming?
Thank you.
I texted Colleen, I'm with the Zoom a minute or two ago, so.
Colleen, just give us 1 second. Por favor, thank you.
Yeah, no worries. I recognize that I am a minute or two late. I was actually doing another presentation. So yes, I saw 5 minutes and I am standing by. Thank you.
Sorry.
Colleen, are you gonna present, or do you want us to pull up the slide deck? Now
Oh,
you're
you're
on mute.
muted.
Colleen, I probably need to head out around 11:30, 11:40, but.
Well, you know, I'm just here for just quick.
Cool.
Yeah. So I did send a PDF in Teams. If you want to do it, that would be great, Tim. It's in the packet.
Oops,
Boy,
oops.
happy clicker. That one. Click one more time.
How about,
Right.
why is it weird?
You can
Like-
download it, yeah.
Yeah.
Okay, here we go.
Let's see.
Awesome. Thank you guys so much. So kind of from our last Board of Health, it was just like, hey, instead of going a full quarter, why don't I just come into a work session, kind of talk about, you know, where we're at. And so, yeah, that looks great.
Sorry. Yeah. You did.
Yeah, I mean, it looks great to me. So however it looks for you guys works for me.
Awesome.
Awesome. So yeah, so basically, you know, from our last conversation, these are our strategic priorities, right? Stabilizing our agency, doing community health, and increasing awareness, education, advocacy, etc. Next one, please. And so this is our org chart as it stands right now. So we did bring in a deputy director, which is Kelsey Maxey, as you guys know. She's also supporting the environmental health piece of retail, food, school, and childcare. And this is how we anticipate it being broken up as we go. And when we look at open positions, one is our immunization nurse, which we've been looking for since March, which we haven't had any bites yet. And hopefully that'll change. Maybe there'll be some new grad coming out who really wants public health. And then our communications position is open but not posted. Currently, we are waiting for the county person to come on board and then talk to them about our job description and whether or not we have to change it, add anything to it, with the hope that we can hire that position. Because when we think about our strategic plan, one of the big three is truly that communication piece. And currently it's being handled by like multiple people, mostly Kelsey and Taryn has stepped into our communication realm right now just to keep us updated and relevant out there. As you guys know, we have a huge week of Pride Week, and today is a huge Pride Resource Fair happening at the 6th Street Gym beginning at noon. So it's been, you know, really important that we continue to have the ability to advertise. So my hope is that we're able to open that position up soon so that we can have someone dedicated 100% to that. It is a part-time position for that. And so we'll work on that. And then the other position that I just put open in the sense of when we talked last time was like, what is that right size? What is that piece that we want? It truly is looking at, and I just put it as a big wide berth of behavioral health. And we think about initially harm reduction, namely Narcan and fentanyl, which we now have possession of. And we're working on some education pieces, and we'll work with law enforcement, then we'll work on rolling it out to our businesses and making sure that people have access to it. And we'll have more information on that, but it'd be nice to have somebody who's really dedicated to all those things that, you know, not only substance use with Narcan and fentanyl, but also thinking about suicide prevention. We also have child fatality prevention pieces that I have reached out to an agency called the Trailhead Agency, and they do a community health worker model. They actually have like a 9-month training program. I'm looking into it to see if it's even a viable option because they do pick up that funding for part of a year. Plus, we do have, as you guys know from the last BOCC meeting, we do have additional funding for workforce stability and building up our workforce. So my hope is that we'll have the ability to use that. Not ready to launch that as I'm looking at some of the options and what we can or can't do. And that's just kind of giving you an update on that. Any questions on that?
The only thing I think I'd like to see with that harm prevention and reduction is just perhaps we can make that person the point person with the regional work.
Oh, I think that would be my plan.
Okay.
For sure that we'd have one person that we funnel everything, who's funneling everything out to us. So
Yes.
Kayla and I both sit on the opioid settlement. I don't even know, would you call it a committee? It's a much larger group with all the 5, and it's a lot of time and energy to go in those meetings. And between her and I, you know, we try to always be on there, but that's not always possible. We also have representation from Heidi, you know, from the 5th Judicial District, but it's just not the same if it's us. So yes, Kayla, that would be my plan, is truly to start off there and really have someone getting dialed in all of that, because I do think there are pieces that, you know, if we have somebody who's dedicated who can grow this program really well versus, you know, me taking it on, getting the supplies in. We just did an in-service with Chaffey County for them to show us, hey, this is how we educate, this is how we do it. And it'd be great to have that person. So maybe that's something we can move through faster. I just want to see if this community health worker model might be the case, because it doesn't have to be someone who's got years and years experience. I feel like so much of that can be learned, and it might open up a position here locally versus trying to bring in somebody with like a higher level of expertise. So thank you for that, Kayla.
Yeah.
I don't have a like specific suggestion, but on that too, you know, like I was thinking, are we not like duplicating what the SO already might have in programming? I don't know, like, let's make sure.
No, this is, sorry, go
Yeah,
ahead.
no,
Go ahead.
well, I was just gonna say that this, like, and maybe I'm not thinking about it quite right, but that would this person like kind of be that convener, or at least pulling all the pieces together of like the smaller efforts by partner organizations?
Yeah, that would be 100% of, right, of someone being the point person who can, hey, I have a question about that, resources, or hey, we need Narcan, can you order it? We have that ability to order, because like we've been working with the sheriff's office, you know, with Heath specifically, trying to figure it out. We're actually reached out to CDPHE to see, they have somebody who's law enforcement specific to do a presentation. So we're waiting on that. And so that's basically, I'm, you know, doing those pieces right now. But to your point, it would be somebody that has the ability to support, you know, all the other work, and not to duplicate, but just to like, okay, what do you need? What do you need? And bringing that in, because we're ready, you know, we're ready to step into that arena, so to speak. We're in that harm reduction of like, hey, we can start moving some of these pieces along.
Thanks. Anything else to add on that, Tim?
No, this, was gonna say, it's not work currently being done, it's merging work that Colleen and Heath are leading as we've talked through it this year, and then, seeing as Heath, right, is staffing up and seeing like more increased drug-related crimes, on things that we can do. So,
Great,
anyway.
awesome.
Yeah, and I think the other, I don't remember if we talked about it, but we did fill our Aging Well coordinator position with Rochelle Collins. So she has hit the ground running since May, mid-May, I'm trying to think. Julie left May 11th, and I believe she came in a couple days later, and that's been going really well. One of her strengths is that kind of social piece and bringing folks together, and I think that's been really great for our seniors to kind of see the continuity of some of the programming and opportunities for new things coming their way. So that has been a really, really great hire in that respect. So that's been very exciting.
Yeah, it was nice to see her, at the COG, that strategic planning. Does she plan to go to the COG meetings?
Well, so we haven't had a AAA representative in a while. We had somebody who was on our advisory board, so we are looking to see who we can plug into that role. And for the AAA specific, I think the larger COG meetings, I believe Jeff was attending those at one point, but the AAA, so that area on aging meetings. But we do talk with Tom pretty regularly at this point. He's trying to do more in Lane County. So Tom being over the AAA piece.
Got it. And they meet separately?
They do. Mm-hmm.
Okay.
Yeah.
I'm wondering if you can connect me with Rochelle, because I've been in contact with somebody from the SILT, is that what it is?
Silk.
The disability, what is it?
Colorado Statewide Independent Living Council.
Yes, and it's for like aging disabled populations, regarding some representation on that council. And so I'm wondering if you can connect me with Rochelle, that I might be able to connect her with this.
I love that. I think that sounds great. Like I said, one of the big conversations we've had is, really trying to link up into some of the bigger ways and seeing what's happening elsewhere and being a part of those conversations to see if anything, knowledge, right, is great. But then if there's anything that can be applied locally is the gain, right, is that nugget. So yes, I will definitely do that.
Yeah, and I don't know if it's a good fit locally, so I would really want to make sure that I'm working with Rochelle to make sure that I'm not like, yeah, we'll sign the dotted line. And
I fully agree, right? And it'll be like, we look at that. No, I think I can appreciate that. So thank you. Yes, I'll link you guys up. That sounds great.
Okay, cool.
Awesome.
That would be awesome.
Okay,
Thank
next
you.
slide. Yeah, of course. Next slide.
Yep.
So I just wanted to give you guys an overview. So when we talk about community health, so, when we think about my strategic plan, these are some of the things I was able to pull out. So these numbers that I pulled out from our electronic health record just kind of gives you an idea of, how many folks we've served. And this is across all our direct service programs. This does not capture all of the other, this doesn't capture any of the environmental health pieces. This does not capture any of the folks coming in for assistance or the phone calls that we feel. This is truly just grabbing it from our electronic health record. So when we look at some of these, demographics, it's just giving you a snapshot of kind of like who public health is serving. So this was for the year of 2022. More females than males, as well as folks unknown declined, or we don't have great categories. That's something we're working on right now. So when you fill out our paperwork, it has male, female, or other. It doesn't give an opportunity for folks to be able to express themselves. And so we're hoping to change that and make our documentation much more representative. And then as far as insured and not insured, insured includes both our public and private, so public being our Medicaid clients as well, but still, even with that population in the insured, we still serve a large number of uninsured folks as well. Next slide. And then the other piece being, as we're well aware of, is, majority of the folks that we do serve in our agency identify in that Hispanic Latino category versus our not Hispanic and Latino category. And then we do have some others that we teased out, but this is just for the sake of big picture. And then when we think about the language that people check, most folks that we serve have English, but I'm going to tell you that does not necessarily mean that English is their first language. It's just that they have the ability to communicate in English as well. So we do know that English, Spanish, that Spanish number is probably higher when we want to think about the language of people's hearts being their first language versus language that they converse in because of the way our systems are set up and they're used to conversing in English, but that's not necessarily. And we try to, as you guys know, always have that interpretation / translation available. So looking at our demographics and thinking about the future, because community health is on our strategic plan. So moving forward, we can look at the next slide. Is when we're thinking of the community health, the piece that you guys know that we've been working on is, you know, looking at the Summit Community Care Clinic and what they can be able to come up and provide. And so this is a list of services they would like to start beginning on September 1st. They still have some hurdles to jump on their side. They are going to their board on the 27th. I know Tim is working on a letter of support from Lake County to support this endeavor. And talking about some of the bigger pictures, things that we might need. Our next meeting with them is on July 5th. I know Tim is on that as well. And if anybody else wants us to forward that invite, we're more than happy. We're just talking logistics at this point, but I think this was the piece of, you know, community health, and just wanted to give you an update of where they're at, what they think they can bring in on day one of coming in. And if you look there, you can see there's no overlap from the services that we provide. Very intentionally that we would still provide our immunizations, our family planning and blood lead, and have the ability, if they had a client there and they needed an immunizations, we would just step, you know, right in and do the immunizations for them. And so I do think that will benefit that person, kind of that one-stop shop for not only our services, but their services as well. And right now they're looking at 1 day a week, which would include behavioral health. And I feel pretty strongly, and I feel like most folks, when we do have this conversation, know that they are gonna, you know, need to expand as their, you know, funding their providers allow, because as you can imagine, standing up a whole new clinic, like a fully independent clinic, is a lot of moving pieces and parts. And so initially they're going to start with one provider. They already have a provider, a nurse practitioner, it sounds like, who's able to dedicate to this time. So that's really exciting that they already have a provider available for that. And so that is where I'm at. And this is my last slide, just to be like, hey, these are our strategic plan pieces. This is where we're at. You know, our next Board of Health is not until August. I do know that from community planning and development that we are going to need to schedule a Board of Health. It sounds like there might be a variance that needs to happen for on-site wastewater and like our treatment system, so our septic. So I'll reach out to Liz to work on scheduling that. That works in David's timeframe, because you guys remember when you do that, we have to send it out 30 days in advance. We have to notify all the other, or we being now community planning and development has to notify, you know, all those folks and do a public notice at least 30 days out. So I think that will probably be the next time we'll get together prior to August.
Okay. Do we have any, like, what's the status on the budget for Summit Community Care Clinic and us coming in, being created?
I don't think they've presented anything to us yet.
No,
We haven't heard anything back from them yet.
This, when they start in September, will be at current public health facility. So the, you know, you guys will review the letter of support next week, but as of now, they haven't, they don't really need anything at the moment. We do anticipate that, you know, once they start, like, it's going to expand, probably rather rapidly. So we haven't had an ask from them yet.
Okay.
Aside from just support, that the county does support them moving into the community.
Okay.
Yeah, and then to build on that, Sarah, the conversation, and I would say email conversation is, you know, they sent a list of supplies. Hey, is there anything on this list that we might be able to share? And I was like, when you look at all these services that they provide, we don't have materials for any of those things. Like, we do not have supplies for, you know, we have a Band-Aid, like we have nothing more complicated than that. And so when we were talking about budget with them to say, hey, you need to budget for all of those supplies that you sent us, you know, we have, you know, some of the equipment like an autoclave to sterilize things and a centrifuge like to spin like blood samples and things that, you know, obviously they can use. And so part of that conversation in this email chain that, you know, I'm having that side conversation of, hey, this is what we have, this is what you have, is, you know, plan for all your supplies, as well as plan for growing out of that space very quickly to really
Mhm.
think about what you can do rent wise. So I have, you know, planted that seed of, hey, you're going to be in our space, but you're going to outgrow. And I do know there's, you know, conversations about, you know, moving us, you know, into a different space and trying to figure out all those pieces as well. As I can see, there's a lot of moving things, but they do anticipate, and I know they're talking from my understanding with their board about, hey, this is probably a temporary space that we have to be able to, you know, budget. Like if they're just be like, oh, we'll try for 3 months and then budget, as we know, that's not how you budget. And so I feel like they do have the full picture of recognizing that they would need to move into a larger space when the time comes. So.
Okay.
And
That's
obviously they're fully aware, you know, they've been on the conversations with Lisa as well, and still trying to figure out some of those if that's an opportunity in the future.
Great.
Yeah, but
Great.
really that's all I have for you guys. I appreciate it. I know that I was a little late, and I love all the cards. And did I miss something? Like, congratulations to everybody and anybody, and thank you for all you do.
Well, thanks.
Like, I don't know, was it like, you know, like Leadership Awareness Day and I missed it? Or
Oh, no, I know.
thank your county commissioners and
No,
yeah,
never thank us. No, that's not a thing.
Oh, it should be.
No, Tim got a card from a kid about Ski Cooper asking the BOCC not to close down Chicago Ridge cat rides and
I
stuff.
think it's an adult.
You think it was
Yeah.
it
This is
looks
all
like a
boy.
kid. It looks like a
Yeah.
kid, but it's.
Well, if we need to, I can operate a cat as
That's
well,
not
so you know.
bad. Yeah, speculation.
Well, they did a really great job.
That's awesome.
Cool. Well, thanks, Colleen. Much appreciated. I guess I don't know that I've shared any other thoughts on like your last presentation of the public health strategic planning. I suppose that's coming.
Well, I think, yeah, and I think part of our conversation.
Comments from us soon? If you
Yeah,
have
no,
any-
but I think, you know, part of the conversation is like, this really isn't like a front facing plan. Like, this is my plan. I'm working, you know, with Tim on that. So it's not. And so all the things that I presented are kind of now appendixes versus like, hey, these are the 3, you know, priorities that I'm working on and the pieces that go with it, if that makes sense. Like, cause we talked about like wordsmithing and I was like, I don't know that we need to wordsmith some of this because it's truly like a behind the scenes kind of my guiding document, not necessarily like sharing it out. Unless there's like something super big, like I don't agree with these priorities or I wanted to add to these priorities. I think that's probably more of the conversation.
Got it. Great. Okay.
Yeah.
Okay. And that's just kind of ongoing at this point.
Yep. Because I'll be the next time I meet with Tim, I'm going to be kind of presenting like, hey, I stuck all the goals in, you know, the county sheet to kind of say, hey, does this make sense? And this is what we're, you know, working on moving forward.
All right. Cool.
Yeah.
All right.
Thank you guys so much. I appreciate it.
Thank you,
Yeah.
Colleen.
Thanks,
All right. Hope to
Colleen.
see you at a Pride Parade on Saturday if you're around.
I will be running up Mosquito Pass, but I'll try to make it.
That's so exciting. Good luck on that. Have fun.
Thanks.
Is that a have
Alright.
fun thing? All right. Take care.
Yes.
Yeah.
I mean,
Thank you. Bye.
Bye, guys.
Well, I'm gonna make David run it with
There it
me,
is.
so, yeah.
There we are.
We're
You
just
guys are
gonna,
coming at 1 today?
I can't be, no.
at the Public Works garage, yeah.
I wish I
Um,
could. It's like my jam.
I was gonna say, you'd be all.
I would
the-
really love to
you'd be
do
able to
that.
do all sorts of different stuff.
I'm working for a friend.
I'm working.
I'm working.
Yeah.
And then we
Alright.
have interview at 1:30.
Yes, you and I do, so we'll be late for